Hello, everybody. Hello, everybody. I would like to thank you for this invitation, and I'm honored to be with you in this interesting conference. I will talk about hypertension in Iraq challenges. First of all, let me talk about the objective of this talk, global hypertension review, and I will discuss briefly from insight of real data, hypertension in Iraq, an arguably unmet need, and finally, home message. Let me start with the globally burden of hypertension in 2025. We believe that the hypertension prevalence will be escalated up, and the prevalence of hypertension globally is expected to be 29.2 in 2025, and mostly in those low-income and middle-income countries comparing to the high-income countries. The history of registry in Iraq started the first one in 1979, first population-based survey, and at that time, cutting off level 160/90 systolic and diastolic, and the result at that time, the prevalence of hypertension was 12. Another big study did in 2015 by Minister of the Health, it's a cross-sectional household survey, and randomly selected 4,120 persons age above 18 from both gender. At that time, some of governate out of control, and the survey done in 3 steps. The prevalence of risk factor in non-communicable disease in Iraq, and hypertension is one of these risk factors, and evaluate the effectiveness of implementation of the national program for prevalence and control of non-communicable disease in Iraq. The result of this big study, mean systolic blood pressure was 128.5, and mean diastolic blood pressure was 82 millimeter mercury, both increase with age, higher among men versus women. And the prevalence of hypertension in Iraq in this study was around 35.6 when take the cutoff value when 40 systolic and 90 diastolic, was higher among men as compared to women. Also, the prevalence of hypertension when cutoff value more than 160 and diastolic more than 100 was at that time 18.7, and the evidence was higher in women comparing to the men. And definitely we found that the hypertension in Iraq, almost always the big number, uncontrolled and no on medication. As diagram, this figure shows that around 68% of study was not on medication and not well controlled, and only 23.9 on medication and not well controlled, and small number, around 7%, not only on medication and well controlled adherence to the medical therapy. The cascade of care in managing hypertension in Arab world. It's a systematic assessment of evidence of awareness, treatment, and control published in 2020. And conclusion of this article, so this analysis of cascade indicated that a barrier to proper diagnosis and adequate control are a greater than barrier to deliver treatment, and discuss the potential factor that might be contributed to the gaps in delivery. What about published articles in Iraq? The first one, study did in 2011 under title Hypertension as a Risk Factor, Different Ischemic Stroke and Acute Myocardial Infarction, Comparative Cross-Sectional Study, conclude at that time silent hypertension was higher in Iraq. Salt-free diet non-compliance was higher in both groups, those newly diagnosed and already diagnosed hypertensive, and drug non-compliance was significantly higher in patients with myocardial infarction. Another big study did by Iraqi Hypertension Society, published in 2021, under title of Survey of Hypertensive Patients Visiting Outpatient Clinic in Baghdad, Associated Comorbidities, Disease, and Risk Factor. And this study enrolled around 581 patients and divided in two groups, those who already diagnosed hypertension and another group, another arm, newly diagnosed group. The prevalence of this study of hypertension in this study was 49%. And there is a clear shift of incidence of hypertension toward the younger age compared to the elder age. And the study also revealed that ischemic heart disease was the most common complication, and diabetes mellitus was most frequent comorbidities illness. Those already diagnosed group has higher compliance to treatment comparing with the newly diagnosed hypertension. Another study did in Kurdistan in Iraq under title Prevalence of Hypertension and Associated Risk Factor in Old Adult in Kurdistan. This study also published in 2020. Study involved 1,480 patients divided into selected newly diagnosed and already diagnosed hypertension, and the prevalence was 54% newly diagnosed hypertension and 46% was hypertension. And the conclusion of this study shows that the prevalence of hypertension in Erbil city is higher, with higher prevalence of those undiagnosed hypertension. Study from the Basra, Prevalence and Control of Hypertension in Diabetic Patient, a prospective cohort study published in 2020. A conclusion of this study found that the hypertension was seen 90% diabetic patient in Iraq, and approximately half of them were achieving target blood pressure. From data in evaluation of blood pressure control and associated factor among patients with hypertension, a prospective cross-sectional study in 2019, and this study shows that the blood pressure control was suboptimal, and the effectiveness, a feasible strategy should be implemented to increase blood pressure control in Iraq to reduce hypertension-related complications. What about use of complementary and alternative medicine? It is a cross-sectional study among hypertensive patients in Iraq. And conclusion, the use of complementary and alternative medicine, particularly biological-based therapy, was prevalent among hypertensive patients in Iraq. This practice was associated with patient educational level, marital status, and duration of hypertension. Patient perception of adverse effect was noticed with different modality of complementary and alternative medicine. Therefore, this type of therapy, what we call complementary and alternative medicine, particularly should be suggested only if the benefit is proven and side effect is controlled. Regarding the knowledge and attitude and practice about hypertension and hypertensive patient in Iraq attending hospital in Baghdad, conclusion of this big study found that hypertension in Iraq and our community have a relatively good knowledge and attitude, but still poor practice and compliance to treatment. Home message: need more articles about the incidence and the prevalence of hypertension of Iraq. Non-adherence, cost-effectiveness of drugs, and physician inertia are major problems in Iraq. 24-hour ambulatory blood pressure correlated better with cardiovascular disease outcome than office. For that should be familial. No Arabian or Gulf guideline exist. Focusing on American or European guideline might be unsuitable to Iraqi population. Lifestyle change in the last year in Iraq, stress level are one of the big problems which might be have contributed to increase the prevalence and incidence of hypertension in Iraq. Thank you for listening to this talk.